Hello, I'm David Huff. Let's talk about hearing and noise. Why is it so difficult to understand speech in background noise? I remember when I was a kid sitting at a table in a busy restaurant, pretending to be listening to my mom or dad while eavesdropping on some couple whispering a couple of tables away. Those days are gone. Now I do well hearing a person sitting right across from me hollering. What's happened? Well, two things have happened, probably more. First, I've gotten older. When we hit our 40s and 50s, many of us struggle to multitask as we used to. Similarly, in difficult listening situations, the brain struggles to filter unwanted sounds from speech we're trying to hear. Most young people with their young, active minds can better make use of timing and intensity differences between their two ears to help them filter unwanted noise and focus attention on a particular speaker. Even a young person who has only one good ear can never perform as well in noise as a person with two good ears. But when they have two good ears, they hear sound on one side and their brain translates the intensity difference and the phase differences between the two ears to localize the sound, and if the sound is not of interest, then they don't pay attention to it. As we get older, the brain loses some of this ability, and we struggle to triangulate and focus our attention on a particular speaker and ignore unwanted background noise. So, that's my first problem. I'm getting older. My second problem is that I've got a bit of a high-pitch hearing loss. It's not much, but it's enough to cause me to miss certain consonant sounds, especially when some of those sounds are masked out by surrounding background noise. Usually I can piece together sentences and words in their context, but if I miss too much of the speech signal, I'm out of the conversation. Sometimes I struggle so much in background noise I just kind of give up. I start daydreaming, and then I'm really out of the loop. We have yet to solve the problems that many of us face of hearing well in background noise, but there are good helps for us as we age and our hearing declines. If you haven't already done so, the first step is to get your hearing checked by a professional. An audiologist is trained to accurately test and identify diseases of the ear for proper diagnosis. The ear is a complex organ, so make sure to entrust your hearing health care to a professional. Ask for an audiologist.